Happy New Year and welcome into this edition of ACAP Today for the first half of January 2024. Yes, we've made the threshold. We've crossed the threshold, I should say, into 2024. Welcome in, everyone. On this edition of ACAP Today, we're going to have a conversation about CoverMe.gov. It's Maine's open healthcare insurance marketplace, and you think you may have missed your opportunity, but you still have a little bit of time to get in the open enrollment period. We're going to talk to the person here at ACAP who's responsible for helping navigate individuals in the open marketplace for health insurance. On this week's edition, on this early 2024 edition of ACAP Today, we're going to get to that conversation in just a moment. But before, as we do at each point in the broadcast, at the beginning of the broadcast, we're first going to get into the news and information that you can use again for the first half of January 2024. And we begin with our news and information that you can use with this. It's a new year, so why not consider a new you in terms of home ownership? If you're considering purchasing a home in 2024 or even beyond that, and would like to become more savvy on the home ownership process and the home buyer education process, ACAP has announced our scheduled classes for 2024. Those classes, the first one will be held on the 22nd of January. That one will be held via Zoom, as will the one in March on the 23rd of March, April 20th, and on the 22nd of June. We will be hosting 2 in-person sessions on the Saturdays in February and May, so February 17th, an in-person session, and Saturday, May 18th, an in-person session. More information on where those will be as we get closer to those dates, but for now, if you're interested in our home buyer education class and enrolling in 2024, including the most recent or upcoming class, I should say, on January 22nd, give us a call here at 764-3721, or you can email us at homebuyeredu@acap-me.org. Now, we've talked about this in the past as well, and we're going to talk a little bit about health insurance, obviously, in our feature interview today. But Maine Care for Children and Youth is available now to more households. More children and young adults are eligible for Maine Care. As of October of last year, it's available to children and young adults under the age of 21 at higher household income levels, which you can see there on your screen for a family size of 1 to 5. And if you have more than 5 in your household, you can add an additional about $1,300 there to the monthly household income. So we really are encouraging folks to go to the mymainconnection.gov or to call Maine's Consumer Assistance Program at 1-800-965-7674 for help applying. We also can help folks with applications here at ACAP as part of our health insurance navigation work. We can help folks with Maine Care applications as well. We are also letting folks know that at a rare occurrence here in the actual academic year, we do have Head Start openings available in different locations across Aroostook County. We are under-enrolled in a few locations, and we are certainly looking for children to be able to fill those slots, 3- and 4-year-old income-eligible children. Now, I say income-eligible children, there are other eligibility factors. So if you have a 3- or 4-year-old and are potentially interested in the Head Start program, we do encourage you to give us a call here at 764-3721 at extension 224, or to complete an application on the Early Care and Education page of the ACAP website. Either one of those are great ways to start the process, and we encourage you to do that. The Home Energy Assistance Program, as some of the colder months of the year are upon us, is available to help households. Here too, the income eligibility guidelines have increased slightly. You can see the income eligibility guidelines there for a household size of 1 to 5, but there are eligibility guidelines for households larger than that as well. The application process includes an in-person or over-the-phone appointment and the submission of an application and required documents within an acceptable period of time after that appointment happens. The HEAP application process itself generally takes 2 to up to 8 weeks. This time of year, you can count for it to be closer to 8 weeks, depending on how soon those documents are retrieved or sent to us. So it's dependent on that in part. Benefit amount for eligible household varies depending on the household size, the income, and other factors. Benefits are typically paid to the fuel provider as a credit on your account. We will hopefully have some more information in the coming month about any additions to the HEAP program this year. But for this year, to our knowledge, in the first, heading into the 1st of January here, we are looking at a sizable decrease in the average benefit across the state of Maine, which we understand is challenging for many people. But if you haven't applied for the Home Energy Assistance Program this year and think you might be eligible, need the assistance, please do give us a call. The Energy Direct line is 768-3053, or you can email us at energy@acap-me.org. We've also shared about this. Heat pump water heater incentives are now available. This is through the Efficiency Maine program, so don't necessarily call ACAP for this program. It's not a program administered by ACAP, but rather by Efficiency Maine. In addition to saving on money on oil or electric bills, the highly efficient heat pump water heaters dehumidify the space they are in. So that's good for basements in particular. Thousands of Mainers have them, and the satisfaction is generally high on these. These Efficiency Maine offers free heat pump water heaters, including installation to eligible Mainers. To be qualified as an eligible household, you want to have at least one household member participating in a program like HEAP. So it's a gateway program for this. The Supplemental Nutrition Assistance Program, SNAP, for food assistance, temporary assistance for needy families, or TANF, or the Maine Care for medical insurance coverage. Qualified moderate households may be eligible for elevated rebates based on federally adjusted gross income. And you see the more information there. Go to the Efficiency Maine website at efficiencymaine.com for more information on the heat pump water heater program. We also are reminding folks that the Vitamin Angels program is available, that offers free prenatal vitamins to women of childbearing age here in Aroostook County. Our WIC program administers this, but we are offering it outside of the WIC program as well. If you are an expecting parent or considering becoming an expectant parent over the next year, please give us a call or connect with us so that we can help you access free prenatal vitamins at this critically important time in your development, and hopefully your child's development as well. The Affordable Connectivity Program will continue into 2024. This is helping folks connect to high-speed internet and to provide discounts for connections to high-speed internet to make it affordable for all households in the area. There are also available options for discounts on devices as well, so that you can get connected once you have internet, obviously. If you are eligible, if you want to see if you're eligible for the program, you can do one of two things. Give us a call here at ACAP. We have navigators standing by that do this work and help get people connected to the Affordable Connectivity Program, or you can go to the federal government website, getinternet.gov. And as we head into the end of the news segment here, our first news segment of the new year, we just remind folks out there, we know that sometimes you're challenged with things and you don't quite know where to turn. We do encourage you to turn to us. We have a team of navigators here at the agency that are more than willing to help. They can connect you with staff in programs here at the agency, with other programs that we have here in the agency, as well as those outside of the agency that cover a variety of resources. So please do not suffer in silence. Please do reach out and give us a call, and we can see how our navigators might be able to assist you with any of your needs, especially for folks in crisis. Again, give us a call, 764-3721. And that's the news and information that you can use for this, the first half of January 2024. And as I mentioned at the top of the broadcast on this week's edition of ACAP Today, this early January 2024 edition of ACAP Today, we're talking about CoverMe.gov, Maine's open health insurance marketplace. Karen Milton here at ACAP, who's a program coordinator, is our guest on this broadcast. And Karen, many people may think it might have been too late. Normally, we don't go into a new calendar year considering open enrollment, but that's not the case this year, is it?
That's correct. It's not too late. If you would like to sign on and get a plan, you can have until January 16th, because January 15th is a holiday. You can come in and we will help you get your insurance started for February 1st.
So let's sort of put ourselves in the perspective, Karen, of someone out there who's listening to us and saying, gosh, I still have a chance. I still have the opportunity. What should I do to prepare, schedule an appointment, and what do I need to know about engaging with ACAP or engaging with CoverMe.gov to get into the health insurance marketplace?
There's two routes that you can take. You can take the route to schedule an appointment and come meet with somebody like me who is an assister, and we will recommend that you bring your you bring your W-2s from last year and your completed tax forms, which would actually be for the 2022 year. Or if you have already, if you have your 2023 W-2s, bring them. And we use that for your income. We also need you to have an email address. You don't, you need to be able to access that email address because it is going to be able, it's going to send you information back and forth. But we can help you, even if you've forgotten the password, we can help you get in. I make sure that you have a document that you take with you. It does not stay with me. You take the document with you that has every password, every configuration that we create so that you can get in even if you want to try it at home, if you have a family member that wants to help you, because about 2 weeks into it, maybe 3, you're going to get either the bill for the first premium if you didn't pay it when we set up your insurance, or you're going to get a statement that says, please supply proof of your income, the same income that you brought. We can upload it. We can put it in your folder the day that you come to visit with me, or I have had instances where people didn't bring it. They just wrote their figure down on the document that they had, and we utilize that. Knowing that it's an estimate, the state does require proof, and they will send a letter requesting that proof is met, and you can come back to me and I can help you upload it, or you can take a photocopy of that document and send it to the state in their envelope that they provide to you.
So Karen, you mentioned in that the bill and paying your first month's premium. Many folks out there who are watching, I think of health insurance and think of expense and think of a high cost. Tell me about what customers are experiencing and what folks can expect through coverme.gov. I know that the cost varies based upon the household's income, but is it exorbitantly out of reach for many households, Karen, from your
It
experience?
is not. It is not. It depends. I recommend that folks come in with a budget in mind, knowing, you need to know if you are going to have maybe an upcoming procedure, or you need to know, and you know your body well, if you have a medicine that you have to have on a monthly basis. You know what that cost is when you're paying for it out of pocket, because we have tools that are available to us. We can compare 3 plans at a time, that we can input the doctor that you visit, the hospital that you visit, and the medications you take. Up to 10 medications we can list in there. And when we list them, it will tell you if it's covered or if it's not covered. It will tell you if the hospital that you want to use is in network or out of network. As the same thing with your doctor, it will tell whether or not that doctor is covered or whether that doctor is not covered. There are times we've input doctors' names who are traveling doctors, locums, who don't necessarily get input into the system. So it's going to say that they're out of network, even though they're represented by Northern Light. So those are a few little tricky situations. There's actually a toll-free number that we can call to double check to see if, in fact, because this physician is with one of our hospitals that is in network, if it's covered. And it's really great to look at that. It's great to dive into it a little bit deeper so that the consumer can actually fine tune what they want. I have had couples come in who state, we are healthy, we eat well, we don't smoke, we don't drink, we don't need a lot of medical coverage, but we just need to prove that we have medical coverage. So they take a low premium, high deductible plan, and it doesn't cost them a lot. But then on the other hand, I have had somebody come in to me and tell me, I'm having surgery next month and I know what it's going to take. So we get them geared towards looking at the plans that have a little bit lower deductible, so that we know that it's going to cover the doctor that they're going to go to. It's going to cover the hospital that they use. It's going to cover the medicines post-operatively. There are choices that people can make whether or not it will actually cover after surgical care. So it's a great program. It's so much simpler than when our first marketplace rolled out, I remember looking at it a few years ago and shivering because it was just so hard to navigate. Now, by having the assisters who know the programs and the work list to know what we can tell you to bring with you when you come in, it makes it so much easier for our consumers. And I saw one plan that was as low as $4.14. And if you want to go to a platinum plan, which covers a very lot of things and very low deductible, it can get up there. It can be quite a steep price. But it is all depending upon whether or not you're employed, whether or not you have an affordable plan that's offered by your employer. We actually have had a few people come in that the plan that their employer is offering is way more than a single person can afford for what they're offering. We have a wide variety of plans that are available to them when we go into the marketplace. They're not just limited to the one plan that their employer has.
So you mentioned earlier something about if you know that you have a surgery scheduled next month. Is the open coverme.gov, are the plans in that if you're not currently insured and you get insured, I think you indicated that if you get in the plan before January 16th, that you might be eligible as of February 1st. So is someone who's looking at a surgery who's not currently under health insurance somebody who's eligible for insurance in coverme.gov?
They are eligible. They will be eligible. There may be certain criteria that they're asked to provide. They'll be asked to provide validation and proof of the injury, the illness, make sure that it's not something that is covered under another plan, such as they're going to be asked many times in many different ways. Did this occur at work? Did this occur as a result of an accident? This is occur, but they're actually able to be insured, and they will be covered up to, with their deductible, up to what the limits of the plans actually have.
So the concept of a pre-existing condition is not a denying factor in this particular
Correct.
case. A lot of
That
people
has
are
gone away.
okay. A lot of people are sort of accustomed to that and thinking, "Gosh, I might have a pre-existing condition and I'll be declined." That's good to hear. So we're helping folks get into the
Yes.
insurance marketplace. So talk folks through what happens after they call you. They make an appointment. Do you work with them in person? Do you work with them remotely? How does that all happen?
We can do both. We can work in person, and together we'll sit at the laptop and we will walk through every step. I will provide to them, if they're the type of person that needs to see the concrete information on paper in front of them, we'll print it out and they'll have it in front of them. If they want to look at multiple plans and they want to bounce back and forth, it's easier if I do it virtual with them, because in my office I have 3 screens. So that means I can keep multiple programs open and I can bounce back and forth and show them by giving them access to see what I share my screen, and they can see everything that I'm doing. They see every keystroke, they see everything that we input, so that there's no mistakes. We double check everything. There are many points to be able to go through, and it makes it very easy for the folks that cannot travel in. If they have access to, even if they go to their local library, they can sit at their local library. We can log on together and I can do a Zoom meeting with them just like this, and they can see everything that we're doing and discuss everything together. And like I said, we're assisters. So as an assister, what we get to do is we get to show them many different avenues that they can go down, many different routes that they can go, and let them make that ultimate decision on their own. And as we go through it, we can walk it all the way through to the end, and they can pay their first premium so that they will get their coverage starting, as I said, February 1st, and their first bill would come sometimes during February for the month of March.
Now, we've been talking about this in terms of open enrollment, but like health insurance with an employer, if you have a qualifying incident in the course of the year, you can also get in, correct?
Yes, you can. And qualifying events are events that could be a sudden loss of insurance. It could be, but somebody moves out of your house. Your child could turn 26 years old and you're no longer able to cover them. So they need to come off the insurance. Your child could be covered by a policy at their college, and then when they graduate in May, they don't get a job right away. They may need to be picked up by you. There's another qualifying event. Many different things cause qualifying events, and sometimes people are a little apprehensive to ask, but the coverme.gov portal that you go into has a very good space where they communicate with you as well as you can communicate with them.
And the assistance is available outside of open enrollment as well. So if you have a qualifying event, as you say, in June, you can contact us, correct?
Absolutely, absolutely. And I know that in our local area, we've had a couple of the assisters retire and stop doing it. I've met a lot of people that used to go to Pines. I've met a lot of people that used to go to our associate who was here. But we also have another assister here at our center that is learning now and has been trained, and she'll be able to also assist when anything happens throughout the year.
Now, as it relates to assistance, there are certain populations that we are highly recommending, Karen, that use other experts in the community that deal specifically with folks in, for example, the older Aroostook County resident population. Talk about who should best work through you, who should best work through other partners, and who those other partners are.
I would like to help the folks that are anywhere from the age of 18 to 64 and a half, because at 64 and a half, that's when you need to start thinking about applying for Social Security and doing your Medicare application. That way, I would recommend that you approach a Aroostook Area Agency or Aging, or to approach the Senior Planning Center. Both of them are agencies that are more versed with taking care of our aging population than I am. And I think I took the wider group, so I left them with a just a little bit of help.
So what else do we need to know? You had mentioned that folks can sort of plug and play and see what things would lead to. There are decisions that they can make to help keep the cost down on the premium, correct? Like there's not only the health information and the income information that they can put in, but I think you alluded to selecting what your deductible might be and the like, and sort of seeing what that plays out to in terms of a cost.
Deductibles range from $500 to $10,000. So that's a big difference between that area. And you can narrow down whichever program that you would like. There is an applied tax credit, an APC, that people do receive based on how much they're earning. And the silver plans are best met with that. And you have the availability of choosing a bronze plan, a silver, a gold, or a platinum. And there's usually about 56 different plans that first pop up until we start narrowing down how much you want to have for a deductible, how much you want to have for a premium, knowing that your deductible is what you have to pay out of pocket before the insurance will pick up. And of course, knowing that the premium is the monthly amount that you actually pay.
Now, Karen, we haven't talked at all about main care in terms of what happens in that event. Are there instances where you're working with someone who gives us a call and who you're doing this navigation work with, where it becomes apparent that they may be eligible for main care? And what happens at that point? Is there anything that you can do at that point, or is your work done and they need to work with someone else?
My work's not done, but yet what happens is coverme.gov will automatically tell them, we feel that you are best suited to apply for main care. Here's the link to the main care application, and they'll fill out the main care application and submit it that way. And it still goes to the Office of Financial Planning, but it does ensure that if a person needs main care and they qualify for main care, and they are eligible for main care, that they take main care. We have had in our meetings, because all of the assisters, we meet every 2 weeks, we talk, we have a Zoom meeting, we talk about it. And there are so many people who are eligible for main care who say, I don't want it. I want to pay my own way. And I hesitate if anybody ever says that to me, because I understand that they want to pay their own way and they want to be part of taking care of themselves. However, if they qualify, we would encourage them to apply to get onto main care to help, because it does reduce how much out of pocket they would actually pay.
Right, and it may just be that that's what's needed for the time being because of loss.
Indeed,
Or
indeed. It can be a 1 month, it can be a 3 month. You never know what it actually what actually comes down to. And I think the help is a good helping hand.
what else would be very helpful for folks to know, Karen, in terms of the experiences that you have had engaging with folks to try to get them enrolled for a healthcare plan, a healthcare insurance plan here, that it would be helpful for others to know most frequently asked questions, those things you stumble upon. What else is helpful?
One of the things that I have encountered is there are folks that don't understand that we can do this for them any time of year, as you said. I've heard so many times. I used to use ACAP, but I stopped when they did the marketplace. I thought I had to do it myself. That's what we're here for. We're here to help. One of the things that we have done for security wise for our consumers is the computer that we use to enroll in their plan. We've set it so that it does not retain any passwords. It does not save any numbers if they use their debit card to pay their premium. It does not save any of that stuff. We make sure all of the documents, and I print off a schedule of benefits for every consumer so that they see, okay, this is what your plan is. This is what your plan is going to take care of. This is how much you're going to have to spend out of pocket. This is how much you're going to have to spend per incident. I make sure they walk away with that, because I think that's one of the most important documents that a person can have. We also have the availability, depending upon what plan you go into, we have the availability to go in and look at what's called the formulary, which is the 5 different tiers of medications that are covered by the plan that you've selected. So that there are some people who they only want to try to get the $4 prescription that's available at Walmart so they can get that least amount. But sometimes our doctors prescribe things that are newer medications that our insurance companies do pay for, but they may be in tier 2, tier 3, tier 4, which they are a little more expensive, but it does help if you know beforehand when you go to your doctor, this is what they'll cover, this is what they won't cover. I've learned myself that even our plan, my husband and I each have 2 plans that are almost exactly alike, but yet one medication he gets, it's the same darn thing that I have. They will cover for him and they don't cover for me.
Hmm. Interesting. It's always a challenge to try to follow
It
the,
is.
the complexities of the health insurance marketplace and the nuances of billing and coding, which is what
Correct.
that what should folks do with the clock ticking 16th of January is right around the corner here. If they're in need of assistance, reach out to you
Reach
directly.
out to me. You can reach out to me, contact us at 207-764-3721. Ensure that you leave a message that you want some help with Cover Me. Our receptionists and our team, the comprehensive intake team, they know what we need. They know who they need to get in touch with. And usually I schedule a 2-hour time frame. It normally does not take 2 hours, but I will schedule a 2-hour time frame just in case we get hung up, just in case you have to go get something. And it makes it so that we're not pressured, we're not stressed, and we don't rush.
And what could be helpful since we are running closer to the end of open enrollment, and unless you have a qualifying event, as we talked about, we don't want folks to have to wait another year before getting into
Right.
the insurance marketplace if they don't have to. What would be helpful for them once they schedule a time with you to bring with them to that appointment so that they can be done for the most
We
part?
need to proof of income. Most definitely, we need you to keep a list of the expensive medications that you take, a list of your doctors, and know your budget. That's the most important thing, is to know what you feel that your family can spend. Because I have had a couple of consumers, not only did they get medical insurance, but they also got dental insurance because they found that their medical insurance cost them less this year than it did last year. So they actually, we start the process over again. It's very quick, but we just have to enter back in again, and we can do dental as well.
That's a good, actually, it's a very good point because we haven't talked about that. Should folks who are already enrolled in a plan that have done this work in previous years, should they check that back out again to see if they've got a better deal coming to them or changes
They
that?
can do one of two things. If they were enrolled in a plan and they made their premiums on time, they were automatically re-enrolled. They were automatically rolled over to the next year. It's very important to go back in and see what the dollar amount charge is, as well as re-enter the income, because the first time that they applied, they may have estimated income, and that income may have been higher than what they actually made. I had an incident where that happened, and the person, instead of getting one premium, it was reduced by about $30 because they had actually estimated too high.
So things actually in some cases go down, which is
They
unheard of.
do.
Or
They do. It's not always going up.
One thing I think that we haven't talked about in this part, we were talking about offline earlier, is you talked about the protected health information and the measures that we've taken at the agency to ensure, because we're talking about health information, we're talking about financial information. I'm trying to think, there was one thing that you had mentioned earlier that we haven't. Folks are that go through the open enrollment and go through coverme.gov do agree to have over a 5-year period people that can continue to look at any change in household income. Talk about
Yes,
that.
they'll look at your tax records for the next 5 years.
Okay.
And they're just making sure that if it was estimated too high, again, if it was estimated too high, that nobody said that you would get a refund, but we want to make sure that it's appropriately charged, because if it was underestimated, they will determine if you need to pay a little bit more for the level that you actually received. And it usually comes down to a change in the applied tax credit.
So to that point, you talk about a look at for over 5 years of tax returns, but let's say someone enrolls in a plan that starts effective February 1st. They get all the paperwork into you before January 16th. They get accepted. They're in a plan, and they something changes, and in July they become employed and they go to an employer where there's a health insurance plan offered. Do they get to stay in your insurance plan and decline their health insurance at the office for the remainder of this year, or how does that work?
They need to report the change. That's the first thing that they need to do. They need to report that they've become employed and that there's a change. It may depend on what the employer actually offers for a health plan at their site. It wouldn't be right, but I know of one employer that in the local area, there was a customer who came in that he just couldn't afford the plan that was offered to him by his employer last year. He came and he got through Cover Me, and he was covered last year. But then when it came this year, there had been some changes at work. Not only had he had a raise, but they opted into a different plan. And when I sent him back after he found out how much he would have to pay because of the raise, when he went back to his employer, he found that the plan that they had changed to was now more affordable for him, and he was able to take the plan that the employer had.
Now, you had mentioned a household adding dental coverage. So we've been talking primarily about health insurance up until this point, but what else is offered through coverme.gov?
It will be health and dental. The dental is preventative care.
Okay.
Always remember that it's your cleanings and your x-rays once a year and cleanings twice a year. It's there to help you maintain this lovely set of teeth that you have to begin with.
No vision?
No vision, not usually, no. There is a premium plan that covers vision. It's the platinum plan, but I haven't seen anybody buy into it yet.
Good to know.
That's the one that's nearer $1,000 per month.
We talked about a lot. Anything that we've left on the cutting room floor, anything we've left out that you want to make sure, again, folks know before we close it out?
The most important thing is to come and be prepared to take the time to measure your needs, to look at the plans, to see what's available, and weigh what's important to you and to your family.
Right. That's Karen Milton. She is among the team members here at ACAP. Right now, one of the only team members here at ACAP who's providing navigation assistance for Maine's open healthcare marketplace through coverme.gov. That work will continue in open enrollment until the 16th of January. But after that, it does continue for folks who have a qualifying event, and she can explain more to you about that if you want to give her a call and talk to her anytime in the course of the year. And certainly, if you're looking to schedule an appointment, we encourage you to get to that soon, as the deadline for open enrollment is fast approaching. We're going to thank you again, Karen, for joining us. Before we leave you and before we leave folks out there, as we do at each point in the broadcast before we leave, we share our photo of the week, or in this case, our highlight snapshot. And our highlight snapshot takes us to just before Christmas this year, where we welcomed and honored our volunteers with the Central Roosk Association adult program for a year of providing a valuable service to the agency and community. In the past year, this group, shown here, has worked over 250 donated volunteer hours to help organize our community closet. We want to thank them for all of their hard work and dedication to helping individuals. We're getting clothing into families' hands and into others' hands who need warm coats this time of year. So the work is constant as people are bringing in donations. This is the team that helps sort that clothing and get it out to folks, whether they're coming into the building to get the clothing or whether they're using the racks that are placed outside of the building during certain hours. We thank our team of volunteers from Central Roosk Association and congratulate them on a year of service to the agency. We look forward to another great year of service in this worthwhile community partnership we have with them. And that's all we have for this week's edition of ACAP Today. We'll be back in the second half of January with another edition. Until then, have a great and restful start to the new year, everyone. Thank you.
Thank you.